Okay, so let's talk about the ribs. Okay, so first and second ribs today. So these are, as you know, these will be atypical ribs. Okay, so let's come to the first rib. So this is the appearance of the first rib. So obviously it is so different from the other ribs, right? So it's very different from the typical ribs that we have discussed in the last class. You can see it is flat in the superior inferior direction. The rest of the ribs they are flat in the and mediolateral direction. We'll talk about this. Okay, so it is most acutely curved and this is usually the shortest. So if you have a set of ribs, this first rib will be the shortest rib. It is broad and flat. Okay, so you know this. The first rib is broad as well as flat. Then the surfaces are superior surface and inferior surface. So in the other ribs, we found that there were a medial surface and a lateral, or more specifically, one external surface and an internal surface. So actually the external surface was lateral surface and the internal surface was mostly the medial surface. But in the first rib, the two surfaces are superior surface and inferior surface. Okay, and the borders are internal border and external border. Okay, in the typical ribs we found that the borders were the superior border which was rounded and the inferior border which was sharp. Okay, along with the costal groove. But in the first rib we see that the borders are external border and internal border. Okay, not superior and inferior border. And you know, just like the other ribs, it will slope obliquely downwards and forwards to its sternal end. Okay, and you know that the sternal end of the first rib attaches by a primary cartilaginous joint. Okay, then the obliquity of the first rib accounts for the appearance of pulmonary and pleural apices in the neck. So you know that the apex of the lung covered by the pleura is not exactly a content of the thorax. Okay, so it projects towards the neck, towards the root of the neck from the thoracic case. So this is because the first rib posteriorly it is attached at a higher level than the anterior end. Okay, so it slopes obliquely downwards. In fact, all the ribs they slope obliquely downwards. Okay, the head of the first rib is small and rounded. You can see the head of the first rib it is much small and it is rounded. Okay, then it bears an almost circular facet and articulates with the body of the first thoracic vertebra. So the first rib it articulates with only one thoracic vertebrae, which is the first thoracic vertebrae. Okay, and the neck is rounded and ascends posterolaterally. So the neck it ascends from the head, okay, towards the posterior direction, and the tubercle is wide and prominent. You can see the tubercle here. It's very wide. It is very prominent. The rest of the ribs, the tubercles are not that prominent. So you can see that it is very wide and very prominent. Then another thing is that the oval facet articulates with the transverse process of the first thoracic vertebrae. Okay, so the first rib articulates only with the the body of only the first thoracic vertebrae. It does not articulate with two vertebrae like the typical ribs. So in the articulation of the typical ribs, we saw how the head of the ribs articulates with two adjacent vertebrae, right? But here, what happens is that the first rib it articulates with only one vertebrae, body of one vertebrae, and of course the tubercle articulates with the tip of the transverse process. Now this thing is important. These are the relations of the superior surface of the first rib. The inferior surface is just related to the apex of the lung, okay, near the apex of the lung, and it is smooth. But the superior surface of the first rib it is rough, and it has these relations actually and attachments. Okay, so you can see this is the external surface border and this is the internal border. Okay, so into the internal border you have the attachment of something called the subpleural membrane. Okay, so the subpleural membrane is attached to the internal border or to the internal border, also the medial border of course, and to the external border you see you have the attachment of the costotransverse ligament here. Then to the tubercle of course you have the attachment of the ligament of the joint capsule of the costotransverse joint. Then external and internal intercostal muscles they are attached to this outer border in this part. Okay, then you have the attachment of a muscle called serratus anterior. Okay, further down you again have the attachment of the external intercostal and internal intercostal muscles. Okay, so and one more attachment here is the costoclavicular ligament. Okay, so the costoclavicular ligament it is attached to the superior surface. And one more thing, there is a tubercle here. If you can see this, in the internal border, you have a tubercle, and this tubercle is called the scalene tubercle. They have not shown here, but this is for the attachment of the anterior scalene muscle. And there are two grooves, okay, one posterior groove and one anterior groove in relation to this tubercle. The groove posterior to the tubercle, it is for the subclavian artery, and the groove anterior to the tubercle, it is for the subclavian vein. So these two structures are related to the superior surface of the first rib. Then to the neck of the first rib, these are the four structures which are related. Okay, from medial to lateral side, you have the sympathetic trunk, then the supreme intercostal vein, the superior intercostal artery, and the T1 nerve root or the thoracic 1 nerve root. Okay, and this thoracic 1 nerve root, you know, it's a part of the brachial plexus, and it divides into two branches. And one of the branches which comes to the brachial plexus, it will be related to the rib in this part. Okay, so this branch is actually continues here. Okay, so these are the four relations in the neck. Okay, and this branch is present along with the groove for the artery. So these two structures are there together. Of course, this artery will later become the the axillary artery. Okay, so these and T1 nerve root, it will ultimately form a part of the brachial plexus. Okay, so as this will enter into the axilla. Okay, so you know that the first rib forms the boundary of the axilla, the inner border, it forms the boundary of the thorax or the thoracic inlet, and the outer border, it forms the boundary of the axilla, axillary inlet actually, right? So these structures will enter into the axilla from here. Okay, so this is important, mainly these four relations. Okay, and the scalene tubercle is on the superior surface in the along the interior border, and this is one of the indications by which you can determine the side and anatomical position of the first rib. Okay, we'll come to this. And this is the appearance of the second rib. As you can see, this is also flattened, just like the first rib, but the features are much more leaning towards the typical rib compared to the first rib, right? And this, of course, articulates with two adjacent vertebrae, but this is also flattened in the superior inferior direction. And the inferior border, you can say this is the groove, the costal groove. Okay, and the main attachments on the second rib are here. It is the serratus anterior muscle provides an attachment on the second rib, so it has a tubercle here. Then scalenus posterior muscle and the serratus posterior superior muscle, these are the other attachment to the second rib, and the rest of the features are similar to a typical rib. You have the external intercostal here, the internal intercostal here. Okay, so all these are attached to the just like in the typical ribs, but this looks more like a first rib than a typical rib, and it has two attachments to two adjacent vertebrae, of course, and this gives attachment to the serratus anterior, scalenus posterior, and the serratus posterior superior. Okay, so again, this is the comparison between the first rib and the second rib. Okay, you have the external intercostal along the external border, you have the internal intercostal along the internal border, serratus anterior muscle is attached here. Okay, then you have the middle scalene muscle on the rib in this part. Okay, so then you have the anterior scalene muscle here, the scalene tubercle, and there are two grooves, of course, one for the subclavian vein, one for the subclavian artery, and the subclavian muscle, some parts are also attached to the first rib in this part. Okay, so mainly these are the appearance of the first and the second rib. Second rib is, you can say, it is kind of like an intermediate form of rib between a first rib and a typical rib. Okay, so after the second rib, the third, fourth, fifth, sixth, all these ribs, they have the similar structures that we had already discussed. Okay, and first rib is more important, mainly these relations they ask. Okay, pay attention to this sympathetic trunk and all. Okay, so that's it. And before going, let's see the ribs once. Okay, so this is the appearance of the first rib. Okay, you can see this one surface, this is smooth. Okay, and the upper surface, this is rough. This is very difficult to see here, but you have to, like, touch to see which part is smooth, which part is rough. But one thing is very prominent is the scalene tubercle. You can see this tubercle here, right? So this tubercle along the inner border is very prominent. Okay, and this is the attachment of the scalenus anterior muscle, and anterior to this you'll have the relation of the subclavian vein, posteriorly you have the subclavian artery, and this is the head. It articulates with only the T1 vertebrae. Then you have the neck here, and you can see that the angle is very prominent compared to the other ribs. Okay, and this anterior end, of course, it will articulate with the manubrium, forming a primary cartilaginous joint. Okay, then you have this. This is the second rib. Okay, this is also just like the typical ribs I told you. The anterior end is at a lower level than the posterior end, and this is also actually flattened in a superior inferior direction. Okay, this looks more like a first rib than a typical rib, but you can see that it is much longer than a first rib. So these are the two ribs, first rib and then second rib. Okay, this one is much longer, and you can see this has a more prominent costal groove than the first rib. The first rib, the inner the lower surface is actually very smooth. It does not actually have so much of features or any grooves and attachment as such. Okay, but the superior surface is much rougher. Okay, I think it is a little bit prominent here. Okay, so this is the inner or the lower surface. This is the outer or the superior surface. Okay, and here you can see the prominent costal groove. Okay, for the second rib, but this is also flattened superior inferiorly kind of. Okay, after this, the third rib it will be flattened in the medial lateral direction. And the second rib, of course, you know it articulates with the sternum at the level of the sternal angle. Okay, and you can see the head, if you can make out, there are two tubercles here. I mean the two facets which will articulate with the corresponding rib and the rib above it. Okay, then you have the neck, tubercle, shaft, upper. That's it. Thank you.
Thank you, sir.